Hey everybody, my name is Matthew Estrad. I'm a gerontologist here in St. Tammany Parish, and this is another edition of Caregiver Coffee. Today we're going to be talking about delirium. Now, this is the second video that we've done on delirium. The first one was about a year ago. It's here on the YouTube channel. I encourage you to check that out. There's going to be some overlap, but I think that you will find this helpful as a sort of like a addendum or I'm not sure, part two. So anyway, I think this will be helpful because delirium is a very serious medical condition. It's important we recognize it. It's important that we work to prevent it. So before we get into this really interesting and important topic, just a little bit about the caregiver support group. Every Tuesday evening of the year, basically, unless it's a holiday, and certainly we don't meet on Mardi Gras Fat Tuesday. But if you get if you subscribe to our private email list, you'll get reminders on the Tuesdays on every day that we meet. Excuse me. And then when we come out with a new 2-month flyer, 2-month calendar/flyer, you will have access to that too. So you will be able to see if there is a holiday or if I happen to be out of town and there's a conflict, you'll see where we've moved it because we rarely ever cancel. We typically just shift it to a different day. So hope you check that out. Get on that email list. Basically, the format of the month or the formula of the month, the schematic of the month is first Tuesday of the month, and these are all 6 p.m. starts. First Tuesday of the month, we're in person in Slidell. Second Tuesday of the month, we are on the Zoom platform, so you can join smartphone, tablet, regular phone. You can call in. The third Tuesday of the month, we are in person in Covington. Sorry, lots of loud noises here in my home. On the fourth Tuesday of the month, we are back on the Zoom platform, and sometimes we meet on a fifth Tuesday if there is one. But we will let you know. We'll confirm because we always check with Coast to see if they want us to meet. All right, so on with delirium. First, I want to mention that some of the sources that I've used. So we're going to draw upon the foundational delirium research of Sharon Inouye, MD, whose article in 2014 in the New England Journal of Medicine remains the gold standard for understanding delirium's causes, presentation, and prevention. Additional evidence comes from a 2017 review by Marcantinio in The Lancet and the American Geriatric Society 2015 clinical practice guidelines for post-delirium and the Hospital Elder Life Program, also known as HELP, and the Alzheimer's Association's 2025 Dementia Care Practices recommendation, which emphasizes early recognition in community settings. And I'll put this in the description of the video. So why does delirium matter? Well, delirium is one of the most under-recognized medical emergencies in older adults. It often appears out of the blue, which is why families think they think that it is a stroke or they think it is a sudden dementia. Research shows that delirium is associated with higher mortality, faster cognitive decline, and increased risk of nursing home placement if not caught early. The good news is that 40% of delirium cases are preventable. That's according to that 2014 New England Journal of Medicine article that I mentioned at the very beginning. So delirium is part of the brain's version of a fire alarm, loud, sudden, and telling you something is wrong. Let's jump into delirium versus dementia. Very quick comparison. So dementia is a slow, predictable decline over months or years. Now, sometimes there can be sort of like a stair step to it, but it is the important thing is it's slow and it's predictable. Delirium, I'm sorry, that the decline is predictable, not behaviors or how long someone might live with dementia. That's not predictable, but we do know it's slow and it's progressive. Delirium, however, is a rapid change and sometimes within hours. Dementia affects the memory first. Delirium affects attention first. Dementia rarely fluctuates dramatically in a single day. Now it can, over a week or over a couple of days, you can see some ups and downs. So it rarely fluctuates within a single day. Delirium often will fluctuate in a single day. And a person with delirium a person with dementia can also develop delirium, and this is often missed. So the rule of thumb for a caregiver is if your loved one was fine yesterday and they're confused yesterday, think more delirium than dementia. All right, so what are some of the early warning signs of delirium? The first one we mentioned this as a differentiator between this and dementia is changes in attention. So that's the first sort of like warning sign. Changes in attention. Someone can't follow a simple conversation. They lose track of what they're doing mid-task, and they have difficulty focusing on a TV show or reading or something else. There might be sudden confusion such as not recognizing familiar rooms, asking where am I, putting objects in bizarre places. Now, so far, all of these seem like things that happen to those who are living with dementia, and they are. But remember, the sudden change is really the key. Um, Behavior changes could be agitation, restlessness, pacing, suspiciousness, like someone stole my wallet, someone stole my glasses, something like that. Hallucinations, typically visual, but can be auditory as well. Physical signs, new difficulty in walking, slurred speech, tremors, dehydration signs such as dry mouth and dark urine. All right. We must also, so all of these are all, you know, these are all noticeable things. You'd probably agree. We also need to look out for what can be called a quiet delirium, where it's sort of the opposite of all these, more like exciting things, not in a good way. So someone who might withdraw, someone who's sleepy or sort of foggy or out of it, they may be maybe less responsive. And this form is dangerous because it's easy to miss. And we might get caught up in getting our tasks done or doing things because our loved one is being quiet. But that should send off an alarm as well, even though we might be productive. And it might be great that we're getting a break and we're getting things done. So we want to look out for that quiet delirium. So just overall, think any sudden change in thinking, behavior, or walking, this should raise a red flag. Common causes of delirium. So infections. So we're thinking urinary tract infections, pneumonia, skin infections. And I think this is where most people go first. They think UTI as that. But that's not always the case. It's good to think that, but don't rule out these other things. And this is why medical attention is really important to actually figure out what it is. So we got infections. We've got dehydration, especially in hot water or after an illness. There are medication changes. So it could be new medications, over the counter or prescription. There could be dosage changes, and there could be interactions between the different medications that is maybe specific to a person and not anticipated. Or it can be something that maybe the doctor should know but did not catch that these two drugs, drug A and B, could have side effects when combined. Some mistakes like that do happen. Another common cause of delirium is pain. So untreated pain can be a major trigger. Constipation. Most people don't think about this until it happens, I guess. But constipation surprisingly is a cause. Low oxygen, if someone has COPD or heart failure. And hospitalizations. Think about the unfamiliar environment. Think about if this is an overnight stay. Think about the sleep disruptions. A nurse or another staff member coming in and taking blood pressure and vitals, every couple of hours. Waking that person up. The beeping of the machine. So it can be really hard to do that. Plus, you're in an unfamiliar place. Your hospital room may or may not have a window, which is orienting in itself to know that it's daytime versus nighttime. So hospitalizations should have a special focus on preventing delirium, especially if there's an operation or some kind of procedure. So delirium is usually the first sign of a medical problem, not the last. So what should caregivers do? Check temperature, encourage fluids unless restricted by the medical provider, review recent medication changes. I'm a big fan of using the online medication calculators that will look for side effects, that will look for, well, especially side effects such as anticholinergic burden for older adults. It will look for drugs that should not be combined together, and other things. So you just type them in. You don't even need to put your name. Medline is one of those reputable calculators that you can that you go ahead and try. Look for signs of infection. So this could be coughing. This could be a burning sensation with urination. And when you call the doctor, if you call the doctor and you're talking with the attending or whoever you're able to reach, you can simply say, "My loved one has a sudden change in thinking. I am concerned about delirium." I think using those words right there, just being very clear and mentioning delirium can catch their attention and hopefully get some action. You want to bring a timeline of symptoms so that because caregivers rely heavily on reports, and you want to rely on a written notes that you've made, not from your memory, because you might be short of sleep. You're probably stressed out. You're probably worried. So it's best to just, have that small notepad or big notepad and, track all the symptoms and times. So when do you go to the emergency room? Now, this is not an exhaustive list. These are suggestions. Obviously, you're just watching some education on YouTube, so you want to use your gut. But some suggestions are when your loved one has hallucinations, and this is, remember, something sudden. Um, if your loved one's had dementia and you've known this for a while, and this is not the first time they have had hallucinations, you probably don't need to go to the emergency room. So we're talking something sudden. This has not happened before. Go to the ER. Okay. Severe agitation, inability to stay awake, and suspected stroke. These are reasons. And again, this is not the full list. If you feel like going to the emergency room, I encourage you to do that. How do you prevent delirium? And this is be our last subtopic. Um, get your loved one on a hydration schedule. And we've talked a little bit about hydration in the past. Be creative with the hydration. Use fruit, use Jello, use flavored drinks. If they're not wanting water, so just be creative. Regular meals are important. Glasses and hearing aids on, clean, working, tuned in, etc. Good sleep hygiene. So that means no lights or low lights. It means no sounds, no interruptions. Uh, things like a cool room, maybe a cold shower, a cold bath before, but just comfortable clothing. Avoid unnecessary sedatives and anticholinergic medications. Keep a consistent daily routine if possible. Just the majority of the time. There are going to be some days that it's going to be hard to keep a schedule, keep that daily routine, but the more you can do it, the better it is. And encourage mobility, exercise, simply walking around. I would say even part of mobility and good sleep hygiene is going outside and make sure that you're getting sunlight. It helps your circadian rhythm, helps get you some vitamin D. So highly encourage that. So that wraps us up for this important topic of delirium. I hope that you will consider joining our caregiver support group. And when I say join, I mean just stop by. If there's not a commitment, please just come check us out. We'd love to meet you. We love meeting new folks. They tend to stick around after they've come and talked and met a lot of the friendly people that we have either online or in person. So check that out. Thanks for your attention. Thanks for sharing this with someone. Just remember, when you share this think about this when you share this with a loved one. Now they have this education. They can look out for you, and they can look out for signs. In this case, they can look out for signs of delirium. So you're now educated because you stuck around the whole time, and you're going to be on the lookout for these signs in loved ones and friends. But you want others to have this knowledge too, so they can take care of you. So, all right. Thanks for watching, and I look forward to you seeing us and getting some more education and future caregiver coffees. All right, take care. Bye.